Hello, I'm Dr. Nikhil, Associate Professor in the Department of Panchakarma from Yenepoya Ayurveda Medical College and Hospital. So, today we will have a discussion about the introduction to Panchakarma and its clinical significance. Basically, the moment you hear the word Ayurveda, the next thing which would strike into a common man's mind is always Panchakarma. It's a common thought that always Panchakarma and Ayurveda are read together. That's how the interpretation, whenever we when we start talking to people, whenever we start talking to our relatives or family or friends, those who seek another option for the alternative medicines, then the first thing that they usually choose will be Panchakarma and Ayurveda, or in other words, Ayurveda and Panchakarma. So basically, it's the same. Or I have to say that Panchakarma is an effective tool in the management of diseases. So let's first try to find out how does Ayurveda look upon into any disease or in preserving the health of a healthy individual. So Ayurveda says swasthasya rakshanam and aturasya vikara prashamanam, which means that preserving the health of a healthy individual as well as treating the diseased. So that is the primary aim of Ayurveda. So when we say about preserving the health of a healthy individual, also when we speak about how do we treat any particular medical condition, any particular disease, then it comes into two different thoughts or two different modules that Ayurveda looks into in treating a patient. So the first one is known as Shamana Chikitsa, and the next one is Shodhana Chikitsa. So let's understand what is Shamana Chikitsa. Shamana Chikitsa can be interpreted as you give some internal medicines. You give some internal medicines which could be in the form of a tablet, which could be in the form of a liquid form of medicine. We usually give kashayam, arishtam in that way, isn't it? Or it could be some medicated powders. So taking some internal medications and trying to bring the disease or any medical condition under the control. That may be termed as Shamana Aushadhi. When I say about Shamana mode of approach of Ayurveda, then we have to primarily understand what is the Vata, Pitta, Kapha dosha. So all of us are quite aware of the fact that any imbalance among the Vata, Pitta and Kapha doshas in the body can cause any diseases. So the Shamana Aushadhas, we are giving some internal medications in order to pacify the doshas which has aggravated. Any imbalance in diseases can cause an origin, or the disease can happen usually because of the imbalance of the doshas. That can be managed with Shamana, that is internally giving the medication, and we are pacifying the disease or we are treating the disease. The second thought is Shodhana. Shodhana means usually expelling. When I have said that the diseases, the doshas has increased, so some diseases or some medical conditions we will not be able to manage with the Shamana medications or giving merely some tablets, giving some liquid form of medicines that may not be sufficient enough to manage the conditions, particularly when it comes into chronic diseases, when it comes into the management of diseases which has been troubling since long. In such a condition, we usually apply a Shodhana approach, or in other words, Shodhana is equal to, or it can be interpreted as the Panchakarmas. So here in Shodhana Chikitsa, the doshas which has aggravated will be forcibly expelled through our nearest possible natural orifice. So when we say about some kind of respiratory conditions, could be some allergic manifestations, or when you say about some kind of pains or different aches in the body, so we may term it as, okay, this particular condition, some respiratory condition could have been caused due to some increased kapha dosha in the body, or maybe some kind of pains or aches can be caused due to some increased vata dosha in the body. So how that vata or how this pitta or kapha can be expelled through the nearest possible natural orifice is Shodhana Chikitsa, or in other words, it is a Panchakarma Chikitsa. Now, as per Acharya Charaka, the Panchakarmas are Vamana, Virechana, Nasya, Anuvasana Basti and Astapana Basti. in the coming slides, we will go ahead with explaining each one of the therapies. And as per the Acharya Vagbhata and Sushruta, it's Vamana, Virechana, Niruhabasti, Nasya and Rakta Mokshana. What is the aim, or what do we foresee by initiating a Shodhana procedure? So the sloka goes like Yadirayet Bahirdoshanam Panchada Shodhanam Chayat Niroho Vamanam Kaya Shidorokko Asravasruti. So which means that there is a procedure where the Prakupita doshas, or the doshas which has increased or vitiated, can be expelled, or it will be expelled through the nearest possible outlet, that is through the Shodhana, that is of the doshas will be expelled out of the body, is known as Shodhana. Now coming into the Vamana. So the Vamana is emesis therapy. We say that Vamana is usually the best line of approach in managing the Kaphaja Vikaras or Kapha Pittaja Vikaras, or the diseases which has been caused due to the increase of Kapha dosha in the body, or Kapha dosha along with Pittaja doshas. Vamana therapy are extensively carried out in the management of certain respiratory tract conditions, certain skin conditions, and so many different diseases are there where you use Vamana we use in a clinical approach. Now coming into the Virechana, Virechana is a purgative treatment. So we generally make a patient to drink some internal medications. We make the patient to drink some internal medications, and then patient will be will be evacuating the bowels in considerably more number of times. So that is purgative therapy or the Virechana therapy. Asthapana Basti means Asthapana Basti and Anuvasana Basti. I would like to read it together. Anuvasana Basti and Asthapana Basti is a enema therapy. So basically in Asthapana Basti, it is the kashayam, it's the medicated kashayam which will be given as an enema. Wherein Anuvasana Basti, it is the oil enema therapy which will be used. Basically the Asthapana and Anuvasana Basti are the therapies where we extensively used in the management, we use it in the management of Vataja Vikaras, or the diseases which has been caused due to the increase of Vata dosha in the body. And the last one is Nasya, or the Erin therapy, where a medicated powder or some swarasa, or a herbal extract of a leaf or any particular part of a plant, or it can be an oil, will be usually instilled into the nostrils. Here Nasya mainly aims at the treating the diseases above the clavicular level, or Jatru Urdhvagata Vikaras we call in Ayurveda. So the diseases which are, and that's what when we say about Vamana or Virechana, so most of the diseases which has to be doshas, the diseases which has caused the increased doshas, which has to be expelled out of the body through the nearest possible pathway. So when it comes into the Nasya, if I have to quote an example, yes, that is installation of a particular oil or any medicated powder or suitable swarasa, or the extract of any particular plant or leaf or anything, that will be instilled into the nostril. So that particularly aims at treating the diseases like chronic some kind of sinusitis, or it might be migraine, or it can be equally some we call it as Kalitya and Palitya, which means that the premature graying of the hair and related hair fall issues and all those things. And also even though Shodhana is the chief action of Panchakarma, so when we subject a person, or when we advise a Panchakarma therapy to a patient or a wellness seeker, our basic intention is to bring Shodhana, or in other terms, it can be used in bringing back the increased doshas into the normalcy. It can also be used for the Shamana Chikitsa, or where you have to somewhere bring the doshas into the normal level, but we need not actually expel out of the body. There are different approaches of it. So Panchakarma therapies are also not just limited to the 5 therapies. There are some Upakarmas. There is always a notion that Abhyanga or oil massage is Panchakarma, or they go for some kind of Kiji treatment, we call it. So that is Panchakarma. That isn't always Panchakarma. That is a Upakarma, that's a part of Panchakarma, or a pre-preparatory part, you may call it as Upakarma basically. That includes internally taking some medicated ghee or some any oils, or maybe applying of the oil, that is Abhyanga or full body oil massages, certain lepas, that is application of medicated paste, Dhumapana and Gandusha, all those ways. So Doshanusara Shodhana. So Doshanusara Shodhana is Vamayet Sleshma Rogana, because we hear in Vamana, or the therapy where we induce vomiting. We make the patient to vomit by giving certain internal medications. So Vamayet Sleshma Roganam. Here Vamana is Sleshma Nirharanartha in Sleshmika Roga. That is, we are expelling the excess kapha dosha in the body. Also not just kapha pittaja conditions also we do use Vamana. So Vamayet Sleshma Roganam and Paitike Virechayet in pittaja condition, because there is a saying in Ayurveda which is that Pittat Virechana Shreshta, which means in the management of Paitika disorders or the diseases which are caused due to the increased Pitta dosha in the body, in such conditions, Virechana or a purgation therapy is the best line of treatment to be followed. Now coming into the Niruhayed Vata Rogan. So when it comes into the Vataja diseases or the diseases which has been caused with the increased Vata dosha in the body, then the Basti or the enema therapy. We have already discussed there are two types of Bastis, where one is you give a medicated decoction known as Niruha Basti or Astapana Basti, and the other one is oil enema, where that is known as Anuvasana Basti. Here, as we know that no Vata Jaroga, because we have come across the individuals who say that Vata Jasti agita, or the Vata has increased in the body. In such a condition, we give some enema therapy. Or basically all these enema therapy, where the Anuvasana Basti or some herbal or medicated oils are being used, that is being given as an enema. That serves very well in getting almost all the joints well lubricated and all those, when it is done together with some external Bahya Sneha therapy, which includes your Abhyanga, Svedas and other relatives which are always a part of Panchakarma. And Raktavaseshana, that is Raktavaseshana. That is Raktavaseshana is a diseases bloodletting therapy or Rakta Shodhanartha, or in order to purify the impure blood in the body. Or there are, as per the concepts of Ayurveda, there are different diseases or particularly skin diseases which can cause because of the Rakta Dushti. In such a conditions, some local bloodletting therapies, which includes your Veripuncture, we call it as Siravyada, and then Jalau Kavacharna, such similar, or even Prachana and all those things. So those treatment modalities will be used in the management of diseases which has caused due to the Rakta Dushti. So putting it again, it's Vamana, Virechana, Nasya, Basti and Rakta Mokshanas all put together. Now the importance of Panchakarma. What is the benefit of doing a Panchakarma therapy? So who are the eligible people to do a Panchakarma therapy? Is it only for the diseased, or can it be used for a wellness seeker? From that point of view, the importance of Panchakarma may be divided into three different points. The first one is Panchakarma in Swastha. Panchakarma in Swastha, it translates into any individual who is healthy, who doesn't have any diseases, can even once in a year, or based upon the seasonal regimens, based upon the seasonal advices that Panchakarma suggests, can undergo to the purificatory therapy. Because when we say the preventive aspects of Ayurveda, when we talk about the preventive benefits of Panchakarma, we have to align it with prevention is better than cure. Due to the lifestyle that we follow nowadays, our body definitely is subjected to a good amount of challenges due to our eating habits, equally because of our probably lack of exercises, and then lack of sleep and stress and other parameters, which always causes diseases as per Ayurveda, also with the other systems of medicine always, because it's stress, eating disorders, lifestyle disorders, eating lifestyle, changing eating habits, lack of exercise, that itself can give a rise to n number of diseases. And here, following a Panchakarma or the seasonal regimen, what Panchakarma or Ayurveda insists, can help in expelling the doshas, or what you say, expelling the morbid doshas or the amatva from the body, or some undigested probably material, or some toxins which get accumulated because of our habits. Okay, so that is a preventive aspect of Ayurveda. We will explain regarding the preventive aspect once we get into the seasonal regimens. What do Ayurveda suggest? Now, coming into the next one, that is Rasayanadi Asadharana Gunaprapti, or for the promotive purpose. Here, Panchakarma therapy can be utilized from a promotive, health promotional aspect as well, or probably we have to say it's a nourishment therapy. It may be coincided with the word of nourishment therapy. Equally, it is a rasayana, or it improves the quality of every organs, the functionality aspects of every organs and organ systems, and in general. So rasayanadi asadharana gunaprapti. If I have to quote an example, then probably the best one to say is, when we near towards the age of 40s and late 40s, 50s, it's very common that all the joints in the body will definitely, and the bones will definitely undergo degenerative changes. That is quite very well accepted. And here, the significance of undergoing this, when there is a degenerative change, yes, that will lead into a pain. That can cause at times stiffness, that can cause at times restricted range of movements. All these, it comes eventually, chronologically, all these complaints start troubling you once we cross usually our age of 50s or more. And how Ayurveda or how Panchakarma looks into these perspectives is, you have to plan very well in advance. Yes, if I have to say about the women who undergo the menopausal changes, yes, there are some kind of therapies which Ayurveda can contribute for their better health. Even in case of men, though irrespective of gender, degenerative changes will happen in every person. As a result of that, and we call it as vata though, or we can say this because of the degenerative changes. Probably it could be the cartilage, the wear and tear of the cartilage, or anything. If I'm just quoting an example. So in such a way, how do we manage it? As I have rightly said before, there is a therapy known as basti therapy, or you can consider it as an enema therapy. Here we are using some oils which will help in lubricating those particular joints, which has some very good actions upon the even cartilage reconstructions, and in that way. So planning for a rasayana, therapy, or planning for any condition, planning for all these Panchakarma therapies on a specific interval of time can definitely help in postponing the event of aging. I have to say that postponing the event of aging, those pains or aches and all which we are most likely to get at our age of 50 or probably 55, we can, if we implement Ayurveda, if we start following Panchakarma on a yearly basis, we can very easily postpone the event of aging. So what I am trying to say is, those diseases or those complaints that are most likely to trouble you at your 50 or 55 can very well be postponed to another 5 to 10 years. So that requires planning. So we can't expect a very quick this thing when I have to say about the Rasayanadi Asadharana Gunaprapti in Panchakarma. Intake of certain medicated maybe oils or ghratas, that is medicated ghee. So those are the benefit. Now coming into the Roganusar Panchakarma, that we have already discussed. See, it's about the different curative aspects. As I have rightly said, when we call say Vamana, yes, it is a Pitta Kaphaja conditions. When you say Virechana, it's mostly the Paitika conditions or the diseases which has caused due to the increased Pitta dosha in the body. And when you say, Vata, it's because of the, when you say Basti, it is an increased Vata dosha can be very well managed, or we have to say Vatat Basti Shrestha. Here, Panchakarma in Swastha, again as I have mentioned earlier, it's the toxins which can be bought outside the body. So what is the benefit is the sloka says malapaharam rogaram balavarna prasadanam pitam samshodhana kale samyakayushe yuchate charam. So administering all these panchakarma therapies on a basis as advised per the particular seasons will help in expelling the toxins out of the body. Also it increases the strength, vigor and complexion of a individual. So now we are getting into the seasonal. What does Ayurveda or Panchakarma has to say about how do we have to prepare ourselves, or how do we have to live, or how do we have to choose between the different Panchakarma options available as a part of ensuring a better health, as a part of giving a better tomorrow to ourselves. So it's during the Hemanta Ritu where the Abhyanga, that is oil massage, Utsadana, Murtini Tela, so all those oleation and some kind of Svedana therapies which can be administered, can be advised during the Hemanta Ritu. Now coming into the, as we know that the Shishira, Vasanta, Grishma, Varsha, Sharad, Hemanta are the 6 Shad Ritus that we call. Coming into the Shishira Ritu, it's a Hemanta Samana Vidhi, or the same procedures like Abhyanga, Murtini Tela, Atapasveda, all those things are advised. During the Vasanta Ritu, as we know that there is a Kapha Prakopa in the body, in that particular time of Vasanta Ritu, Vamana is the most suitable purification therapy as per the seasonal Panchakarma which may be advised. Now coming into the Varsha Ritu, we know that during the rainy seasons, that is Varsha Ritu, most of the pains, aches, neurological kind of pain, that the pulling kind of pain, all will trigger. As we have discussed earlier, Vata dosha is related is best, can be best managed by the Basti therapy. And here in the Varsha Ritu, you would have heard most of the patients complaining my pains and aches are increased. So, or in other words, in colloquial language, they said Vata jasti agita, or the Vata has increased in the body. So, how well do we manage it? How do we can manage it is ensuring or administering a Basti or planning a Basti therapy to a wellness seeker, or planning a Basti therapy to a diseased person during the Varsha Ritu is the most apt time of undergoing a Basti. That doesn't mean that during some other seasons, if someone has a pain or someone has an ache or someone has some Vata diseases which has increased due to the Vata dosha in the body, that doesn't mean that you are not supposed to do a Basti Chikitsa probably in Shishira Ritu or probably in Vasanta Ritu. You are not supposed to do. No, that doesn't mean it. It says that okay, in a healthy individual, this is the most suitable time. In a healthy individual, this is the most suitable time. So as and on when the conditions arises, yes, we may have to do some kinds of adjustments as per the medical condition of a patient. All these things what I am saying is for the swasthya, or in a person who is a wellness seeker who doesn't have any diseases. So coming into the Sharad Ritu, that's when the Pitta dosha in the body is will be vitiated. I mean to say, in Pitta dosha management or diseases pertaining to the Pitta dosha, or a wellness seeker who has minor issues with the Pitta Prakopa avastha in the Sharira can be managed by the Virechana karma, that the Pitta Virechana Shrestha, where some Pitta Prakopa conditions you can take some Tiktaka Gritapana, Virechana, Rakta Mokshanas are to be carried out during this particular Sharad Ritu. Now, there are, when we say Panchakarma, there are some pre-preparations and some main course, pre-operative, post-operative and post-operative. In a very similar way, even Panchakarma has a similar concept of Purva Karma. What are the preparations to be done before planning for any of the Shodhana procedures, which includes your Vamana, Virechana, Nasya, Basti, Rakta, Mokshana, and all the 5 procedures are the Pradhana Karma. That is Vamana, Virechana, Nasya, Basti and Rakta Mokshana. These are the Pradhana Karmas. And after we do this Pradhana Karma, there is something known as Paschat Karma. How do we prepare how do we maintain it? What are the regimens? What are the diet which has to be followed after any of this Panchakarma is being explained in the Paschat Karma? So Purva Karma includes, Pachana, or you have to increase the digestive capacity of an individual, Snehana and Svedana. So these comes under the Purva Karma. So Amapachanartha, we give some internal medications. For example, for Amapachanartha, we give Chitrakadivati, Agnitundivati, and all those. Pachana and Amapachana are always the same. Some kind of peya or churna or kashaya or vati can be given for the Deepana Pachanartha, because while we go ascendingly, when I have to say, if I have to say an example of conducting a vamana, that is inducing a vomiting in an individual, or giving some purgative medications, during that classical way of approaches, the patient will be made to drink a medicated ghee in an empty stomach, in an increasing dosage, based on the condition, the health of a patient, and all those, taking all those into as parameters, the dosage of the medicated ghee will be decided. Here, Amapachanartha means our digestive fire, or our Agni, or the digestive system should be able to digest the ghee that we are giving on an empty stomach. So the enhancement of the digestive capacity or digestive power is a very basic requirement. For that particular requirement, we give Amapachanartha, or the medicines which does the Amapachana. As I have said, Chitrakadivati, Agnitandi. So we are familiar with all those things. So we give it for Amapachanartha Uddesha. And then coming into the Snehana, so use of Sneha Dravyas. It could be a medicated ghee, or some could be oils, internally and externally, is used for Snehana. The aim of giving an Abhyantara or internal Snehapana, or the aim of giving for some local Snehapana, is the doshas which are the root cause for the disease, which will be settled deep seated. It will be seated very deep in the body, and during this Snehana or the oleation therapy, all the doshas which have been adhered deeper into the structures of body will slightly start detaching, or it becomes further easy while we move ahead. Internally, Snehana can be done, that is Pravicharana, Vicharana Snehas and all, where a particular ghee or some oil might be mixed with some food or can be taken, or it can be the Acha Sneha also. A quantity of Sneha which is taken, a huge quantity. Now, Svedana is inducing a sweating in a patient, in an individual, or in a wellness seeker. After the Snehana, that is medicated ghee, either taking internally or also can be used for external application, we are subjecting a person for the Svedana usually. This is a common protocol where this Svedana which will help in the liquefaction of the doshas, and there are the doshas which have been deeply seated, which has been slightly oleated, will be helpful in those Svedana will help in bringing back the doshas. Okay, for the further liquefaction, or that is the benefit of Svedana. Two types of Sveda are there, Agni and Niragni. That depends on the Tapa, Upanaha, Ushmadrava. So we have to understand that after usually Snehana, that is after an oil massage or internally taking any oil applications, the patient, we will subject a person to the either on the same day or based on the conditions that we plan according to particular Panchakarma that we plan. We may post a patient, we will be posting the patient for the Svedana, or the patient will be subjected to the inducing a sudation therapy or inducing the sweating in an individual. So the Pradhana Karmas, after all the Snehana, Svedana and all, that is the pre-preparations, we are getting into the main procedure. So that is Vamana, Virechana, Nasya, Basti and Rakta Mokshanas. So Paschat Karma. So we may for example, if we conduct a Vamana or induce vomiting in an individual, or if we induce to give some medications to give a purgative action, that is Virechana in an individual. So there are certain sets of do's and do nots that we need to follow. There are sets of do's and do nots we need to follow. So that is known as a Paschat Karma. So what is the aim of Paschat Karma? It is done to bring back the body into the normalcy. Because in case of Vamana, what we are doing is we are making a person to vomit. No. And in case of Virechana, that is purgation, we are emptying almost all the contents of our stomach. At that particular point, our body will not be, or our digestive system, and in terms the entire body will not be really prepared to take a food of any type, we may not be definitely prepared to go out and carry out some physical exercises, go to ground play and other things, excessive traveling. There are set of do's and do nots which have been advised, and we call it as we put it under the Paschatkarma, that is Samsarjana Karma, Rasayanadi and Shamana Prayoga and all those. So Samsarjana Karma is after Vamanadi Shodhana Kriya, after this purificatory therapies, as I have told, there will be Agnimanti, or there will be a reduction in the digestive capacity. We will not, our GI will not be suitable, our stomach will definitely be not be suitable to take a food of any type. So foods which are easily digestible. So the food which requires mild digestive power to get in through the process of absorption, assimilation and all those has to be given in the initial days. So foods like Peya, Vilepi, Yusha, it goes in a chronological order, where in very simple ways we begin with the rice soup or ganji that we call in our local language. So Rasayanadi Karma means for what purpose did we subject an individual to the Shodhana procedure. So any of the Shodhana procedure, be it Vamana or Virechana or whatever. So Rasayanadi purpose is, if Shodhana was done for the Rasayana or Vajikarna purpose, administering the internal medications for the same has to be taken as Paschatkarma. So after the diet, once we switch on to the normal diet, eventually from the food which is very easily digestible, adding more and more value to it, and then to the food which we almost probably in a span of 5 to 7 days, we can come back to our normal eating habits. To quote an example, if during the immediately after the Vamana or immediately after inducing vomiting or purgation or Virechana, we are definitely not supposed to have some spicy food and all those things. So all those kind of spicy food and other milk, byproducts of milk and all those things may be taken on a later phase, that is approximately speaking 5 to 7 days. That will definitely vary from individual to individual, but even then roughly speaking it's 5 to 7 days. So after the 5 to 7 days, for what purpose? If Rasayana, if Shodhana was done for any Rasayana or Vajikarna purpose, in such conditions we will have to give some medicines which will further add more result to it. So based on that, you will have to plan the medicines or which will increase, which has got a Rasayana or Vajikarna or Guna, which for what particular intention we have planned for. Yes, coming into the Shamana Prayoga, for is given after the disease Shodhana. That is a common thing, because to enhance, to ensure that the things are being fallen on the right place, we give some Shamana based on a condition. That's all with a patient who is having any particular health issues. Now coming into the Parihara Vishaya. So Parihara Vishaya in Ayurveda, it actually combines of two words. So the literally meaning is Tyaga. Parihara means Tyaga or Varjanam. So the word Parihara states the avoidance of apatya. So the certain regimens which we are not supposed to do. I mean, wrong eating habits, as I have rightly earlierly quoted. Immediately after any of the Shodhana procedure, doing some gym exercises, or going to playground, and excessive traveling, and then you take a night shift or work for night. Those all will cause dosha prakopa in the body. So in other words, the ahara and the viharas, the diets and the regimen that must be avoided during the Shodhana karma. Whenever you are undergoing a Shodhana karma, and even post the Shodhana karma also, you have to consider as Parihara Vishayas, where mainly there are 8 different elements, etam Prakriti Aprapta Sarva Varjani Varjit. So which means that there are some 8 parameters which we should avoid strictly. So the sloka goes in that way, and we are coming into the meaning. Until the normal state of the health is restored, as above, the patient should avoid all the prohibited activities during that period. He should avoid the following 8 dietary and lifestyle changes, which includes Uchchair Bhashya, so loudly speaking. So this can cause pain in the upper part of the body. Rathak Shobha, which means inconvenience which may cause due to the traveling. So what we do is, when I have already gotten an example of Basti or the enema therapy, any individual who has undergone some probably 10 days, 8 days or 15 days or whatever the course duration of Basti he would have been undergone, we usually say, okay, next for at least 10 days, do not travel. You're not supposed to go for a very long distance travel. You're supposed to not supposed to do any strenuous activities. So all those things you can put it under Atichankramana and Atiyasana. So Atiyasana means sitting for a longer duration of pain, or Atichankramana is excessive walking that can cause pain in the lower part of the body. Ajirna, I can say it as indigestion. So eating some wrong food or partly cooked food, all those things. Eating from any restaurants where they do not maintain enough regulatory practices. Ati bhojan or binge eating. If we frequently keep eating, so that again can cause dosha visheshan, amatva formation or morbid material formations in the body. Diva swapna. Coming to Diva swapna is sleeping during the daytime, which as per the classics of Ayurveda, this can cause the kapha prakopa, or Diva swapna is day sleep, can increase kapha dosha in the body. And even though, for example, if we have done vamana to an individual, so our uddesha is kapha pitta conditions will be very well managed with vamana, or the diseases which has caused due to the increased kapha and pitta dosha. Once we do it, and then again during that particular phase of shodhana, the diva swapna, or during sleeping during the daytime, is contraindicated, or we are not supposed to sleep. The reason is we are trying to remove the excess kapha and pitta dosha from the body. Parallelly, if we sleep at night, as per the concepts of Ayurveda, the kapha dosha in the body will further increase. So that is a strict no to it. So maithuna is sexual intercourse and any kind of activities which will cause the vata prakopa or dhatu kshaya, which can cause weakness to the entire body system, entire body in general, has to be avoided. So these are all about in general, what are the do's, do nots, what exactly is Panchakarma. How does Ayurveda and Panchakarma look into the treatment modalities, that is Shodhana, Shamana? What are the different types of Shodhana in Panchakarma? What is the different seasonal regimens that? And what are, once we undergo, when we subject a person to any Panchakarma, what are the do's and do nots in general? So Panchakarma may be termed as an effective tool, particularly in extensively used by all the different branches of Ayurveda. So just like how the modern system of medicine or the allopathic system of medicine has different specialty wings like obstetrics and gynecology, pediatrics, orthopedics. In a very similar way, Ayurveda also has different branches wherein, and all the branches of Ayurveda looks into Panchakarma as an effective tool in the management of the chronic conditions, also for the wellness purposes. So that's a very brief regarding to today's session. So probably we'll meet in the next session. Thank you.